I have been asked to provide an independent evaluation of the healthcare system in Gaza based on my previous experience and to compare from my last visits. This is my third time in Gaza. I had visited Gaza twice during the war, and now it's a ceasefire. First of all, let's start with the nutritional evaluation of the patients. I can tell the food is available right now, and there's a lot of goods in the market you can see, but still patients, my evaluation, still suffering from malnutrition. Most of the patients that we have operated on, we've done around 14 surgeries in the last week. Most of them are anemic, they have anemia, low hemoglobin, and still you can feel significant muscle wasting, indicating the poor protein nutrition for these patients. In terms of the hospital status, I have been working in Al-Aqsa hospital, and the number of patients have decreased significantly compared to the to the war days, and there's no refugees in the hospital. So the corridors are empty, the hospital yards are empty. There was an extension to the hospital called barracks. Also, it's empty right now. And now the hospital is back to its normal bed capacity, which is around 200 beds. So no crowdedness that we have encountered before. In terms of the healthcare staff and the healthcare personnel, the Al-Aqsa hospital was one of the main hospitals that continued to work for the whole war. So there were some concentrations of the healthcare workers here. Nowadays, it's back to what it was before. Most of healthcare workers who lived in North Gaza, or who were from North Gaza, had moved back to Northern Gaza, in the Gaza city, in Beit Hanun and Beit Lahia. And the ones who are working here are only the ones who are originally from Deir al-Balah. So there is significant decrease in the number of the healthcare personnel compared to what we had before. In terms of the medical supplies and the surgical instruments, I can tell for sure, compared to what we have experienced before, there is significant decline in the quality of the instruments as well as the medical supplies. And this is due to the significant siege and the shortage of medical supplies allowed by the Israeli army to go into the hospital. These surgical instruments are the same instruments that we have worked for the whole year. Almost 15 months back, we used the same instruments. So you can tell the needle holders, the graspers, the instruments are really had torn apart, and it's not working anymore properly. So I believe there's a significant need for healthcare, medical supplies and surgical instruments to get into Gaza as soon as possible. In terms of the medical supplies, in terms of disposables, again, we're still having significant shortage of surgical drapes, as well as there's no surgical staplers available, no energy resources for example, the electrocautery are, we have using always, we're re-sterilizing them in order to continue working with them, and it's of poor quality, and they stop working every day. So my overall assessment that although the medical, although the nutritional, part of the food availability is better, still patients are suffering from malnutrition. Although the hospitals are less crowded and the number of patients are less, still, there's, the surgical instruments, the medical supplies are still in significant shortage. And most of these patients who have moved from the middle part of Gaza to the northern part of Gaza, right now, northern part of Gaza, there's significant shortage of hospitals. You all know that almost all hospitals have been destroyed out there, and patients have moved back to the north, and literally there is no proper healthcare system. So I believe there's a significant need to concentrate on the healthcare system to provide instruments, to provide supplies, to provide medications, and to provide even sometimes field hospitals to cover the shortage of hospitals in the north.